So, a very good afternoon. My name is Bhavna Chawla. I come from All India Institute of Medical Sciences in New Delhi. And I extend a very warm welcome to all of you who have come here today. And because this is actually a very special session. Special in some ways. Number one, it's the inaugural session of a society that we have just launched, the Eye Cancer Society of India. And this for this, we have very special guests who are here with us today. Dr. Jyotirmay Biswas, who needs no introduction, and very, very dear to me as my most respected teacher. We also have some young colleagues who are going to join me on this journey and this effort to promote the care of ocular malignancies in India. One is Dr. Rajesh Pate Bahadur. He has trained with me as a PG student. I thought that he will never like to see my face ever in life because of how much I used to scold him during his thesis days. But he is smiling here, so I think that he has not taken it to heart. Okay. And then we have Dr. Rajesh Pate Bahadur is currently assistant professor at AIIMS Nagpur. And we have Dr. Bijna. She is assistant professor at AIIMS Bhubaneswar. They are all also very much interested in working in ocular oncology, eye cancers. So I'm just waiting now for Dr. Natarajan because he is going to take over as the president of this society. He is himself, a very well-known figure in ophthalmology circles. He's holding the presidential position in many other societies. He has great experience, so he's going to guide us and lead us on this path. And we also have Dr. Sunil Singh, who is, yeah, who is going to, yeah, who is the person who has made all the local arrangements here. So I welcome you all. And the reason I wanted to start this society is that so far, like my experience, I work in ocular oncology at All India Institute of Medical Sciences, New Delhi, and there we get a lot of patients of eye cancers. So when we talk of eye cancers, mainly what we see is retinoblastoma in children. We also see cases of uveal melanoma in adults, and then we also see periocular lid cancers, which are more common in our part of the world. So if you see in the West, like, ocular oncology is a subspecialty that has already taken off as an independent subspecialty. But I feel that in India, much needs to be done. Mostly it is just practiced as a side, sort of a branch, either with oculoplasty or sometimes, among retina specialists. Yeah, so I have always been thinking, and when we see these patients coming to us from all over India, we feel that there are very few centers in the country that actually treat these patients, and many of them have to travel long distances, so they come to us at a very late stage, and we are not, despite having all the treatment facilities and everything, we are not able to give the kind of survival rates that are prevalent in the West. So from the point of view of increasing awareness, we kind of need a pan-India initiative, more sensitivity towards treatment of eye cancers, more centers, more specialists who would be interested in taking it up as a full-time discipline. And not just ophthalmologists, we also want allied professionals and our other because it needs a multidisciplinary approach. So we also reach out to pediatricians, medical oncologists, radiation oncologists, community ophthalmologists, everybody, to join in this, effort as a united front. So with that, goal in mind, we thought that we should have a society, because only when we form a society we can work towards a common goal and a common objective. So that is the whole purpose, and I welcome you all here. And I'm also very happy to see ma'am here, Dr. Jolly. She's been my teacher and deeply respected person in ophthalmology. So we need blessings. Thank you, ma'am, for joining us in this endeavor. And we also have Dr. Tejas, who's kindly, spared time to come here. And so, this is a pan-India initiative. So AIOS is, one of the perfect sort of forum or platform to launch something like this, because people from all over India, unless they join us in this fight, we will not be successful. So with these few words, I welcome you to this session. And we are just waiting, we will be, having a small lamp lighting ceremony. So we are just waiting for Dr. Natarajan to join us for that. But in the meantime, I will start with the